big season for flu, big season for respiratory syncytial virus. A lot of people got sick, and we had a surge of COVID as well. And it's all coming down now, thankfully, as you would expect. Now, COVID, just to stick with COVID for a moment, COVID, flu and respiratory syncytial virus, which is a lung infection, are seasonal. They tend to be worse in winter, whereas COVID is not seasonal. There was a global surge in COVID over our winter months, the Northern Hemisphere summer months, tending to go away now, but it will come back for Christmas, almost definitely. I mean, that seems to be the Christmas gift that keeps on giving, unfortunately. And that's the way it's been almost since the pandemic started. So it's not related to temperature, but we're in a lull at the moment for flu, RSV and COVID, which is a good thing. Hospitalizations have gone up a bit in Victoria, but nonetheless, we're not in bad shape in terms of COVID-19.
Okay, what about whooping cough?
So whooping cough, we're not in good shape at all. So whooping cough, this is a bad season for whooping cough. It tends to come around every 3, 4, 5 years, and we've got another surge on. 20-odd thousand cases so far this year nationally, and compared to 2,000 or 3,000 nationally last year. So it's 10 times as many cases, mostly in 5 to 14-year-olds. So that's the age group that's really infected. Now, the problem here is that pertussis can affect you for ages. You can get this cough that goes on. It can cause pneumonia. But we're particularly worried about it because of little babies who are not yet immunized and can catch it. And so you want pertussis levels in the community, whooping cough levels in the community, to be as low as possible. And if there's a lot circulating, then babies are at risk. So pregnant women really must get vaccinated against whooping cough, and they also need to be vaccinated against influenza so that the antibodies protect their babies. But also consideration should be given to immunizing kids who are in those primary school years, because one of the reasons almost certainly for this keeping on coming back every 3, 4 years is that the immunization tends to wane and you need boosters. And so talk that over with your GP.
Okay. Some new research as well into COVID in the last couple of weeks. You've been looking into the long-term prognosis of myocarditis, which we heard a lot about during the pandemic, particularly though in young men after COVID immunisation.
Yeah, there's a low risk of myocarditis, inflammation of the heart, particularly in young men, as you say, after an mRNA vaccine. That emerged after the vaccines were introduced. And the question is, how serious is it? How much follow-up do these young men need? What happens? So this is a case study. This is a study from France of nearly 5,000 people admitted to hospital with inflammation of the heart, myocarditis, for all causes, viruses, COVID, and post-vaccination. So of 5,000 cases, about 10% were post-immunization, and they were mostly in young men, round about the age of 25. And what they showed was it was far more serious to get myocarditis as a result of COVID. So there were COVID cases within this, and that was much worse, more likely to be readmitted, more likely to need intensive follow-up, and so on. However, what they showed in this group of young men, whilst it was much milder, much less risk of needing rehospitalization, that in those young men, they still had some symptoms for a while and needed to be followed up for about 18 months, just in case they needed medication or other investigations. So in other words, it wasn't set and forget just because you'd had myocarditis from the vaccination, which is a very low risk. Nonetheless, if they had it, they needed to, the specialists needed to keep an eye on it.
Right, and so is that something that you would say to young men who, in Australia who perhaps had myocarditis after COVID?
Well, it's much for them as for their specialists. It's just that if you've had that myocarditis, if you're beyond 18 months, you're fine. But if you get it and you've got myocarditis, then you and your cardiologist need to have a chat about being followed up.
Okay. As we're moving further away from the pandemic, we're learning a lot more about COVID, particularly long COVID, and there's some new research that looks into long COVID in kids, really little kids and adolescents.
Yeah, this is a study from the United States following kids between 6 and 17 years of age, just looking at the patterns of long COVID in these kids. And remember, in the United States, they had a much worse pandemic of the more severe Delta virus. Omicron, which is a bit more like the original COVID virus, I should say. And they found that there were different patterns of symptoms in young kids versus adolescents. Young kids tended to have more tummy aches and pain, a little bit of memory and sleeping problems, whereas adolescents tended to have more memory problems, fatigue, and also so fewer bodily symptoms in the older group.
And just finally, Norman, mental illness in vaccinated and unvaccinated people, there's been some research into that. What has it found?
COVID-19 affects every system in the body, including the brain, and the risk of acute mental illness after COVID-19 or worsening mental illness is high. 90% increased risk of a mental illness episode, mental health issue episode after COVID-19 in unvaccinated people, and that dropped down to 16% in people who'd been vaccinated. So vaccination against COVID protects you against mental health issues as well as everything else, so worth doing.